Hey there, parents and caregivers. Welcome back to our channel. Today, we're going to talk about something that's on every parent's mind, making sure your little one is well fed and satisfied. If you've ever wondered whether your baby is getting enough to eat, you're in the right place. Stick around as we discuss the signs that your baby might not be getting full. One of the first signs to watch out for is fussiness during feeding. If your baby seems to be constantly fidgeting, pulling away from the bottle or breast, or seems irritable while eating, it could be a sign that they're not satisfied. Sometimes, babies have growth spurts that can make them hungrier than usual, so keep an eye on their behavior. Secondly, babies do go through growth spurts, but if your little one is demanding to be fed unusually frequently and doesn't seem to be satisfied even after a feeding, it might be an indication that they're not getting enough to eat. Remember, every baby's appetite varies, but if you notice a sudden and consistent change in their feeding patterns, it's worth paying attention. Next up, monitoring your baby's weight gain is essential. If your baby is not gaining weight as expected according to their growth chart, it could be a sign that they're not getting enough nutrients. While some variation is normal, consistently inadequate weight gain should be discussed with your pediatrician to rule out any underlying issues. The duration of feeding sessions can also provide insights into whether your baby is getting full. If your baby is finishing feeds unusually quickly, it might indicate that they're not receiving enough milk. On the other hand, if nursing sessions are frequently cut short or your baby loses interest in feeding prematurely, they might not be getting the nourishment they need. Lastly, wet diapers are a great way to gauge your baby's hydration and intake. Typically, newborns should have at least 6 wet diapers a day, and this number increases as they grow. If you notice a sudden decrease in the number of wet diapers your baby is producing, it could suggest that they're not consuming enough fluids. In conclusion, keeping an eye on these signs can help you assess whether your baby is getting enough to eat. However, it's important to remember that every baby is unique, and some variability in feeding patterns is normal.